Osteoporosis is a silent epidemic that affects 4 out of 10 women and 1 out of 10 men over the age of 70, with hip fracture being one of its most common consequences. Hip fracture is a public health problem because of its high incidence. Osteoporosis affects 3 million people in Spain and nearly 30 million in Europe. This incidence will be higher in the future due to the increase in life expectancy if we do not develop new prevention strategies. It is estimated that worldwide, 1 in every 3 women and 1 in every 5 men over the age of 50 will suffer osteoporotic fractures. 1 year after hip fracture, 40% of patients are still unable to walk independently and 80% have restrictions in many activities of daily living, resulting in significant loss of function. Currently, social and healthcare resources are concentrated during the acute phase of treatment, with significant deficiencies in treatment after hospital discharge. For example, most patients do not receive the rehabilitation they need, and only 20% of European fracture patients receive specific treatment and follow-up after hospital discharge. Finally, informal caregivers are not always considered in the healthcare system, and they play a very important role in the recovery process. This is the reason for the ActiveHip Plus program, a unique 12-week health education and tele-rehabilitation program. It involves patients and caregivers in taking an active role in the recovery process, facilitates digital medical care, and enables remote patient-to-healthcare professional monitoring and communication. Enables continuity of care between patients and professionals. ActiveHip Plus has a mobile application for patients and caregivers where they can find all the necessary resources for their rehabilitation program. In an easy and intuitive way, participants have access to the physical exercise and occupational therapy videos scheduled per week, with a questionnaire at the end of each of them for follow-up by the healthcare professionals. Direct access to the online educational program with specific modules for patients and caregivers. Patients and caregivers also have at their disposal a series of extra resources to complement and expand their knowledge from the scheduled rehabilitation sessions. Healthcare professionals have a web page to monitor and follow up the activity of patients and caregivers with respect to the rehabilitation program, educational program, and medication. The platform also offers a bi-directional communication channel through messaging and video conference. ActiveHip Plus has been designed for hip fracture patients, but the current situation has shown that it can also be used for frail elderly people.